I think 2020 for me will always be history, hope, and heroism, because that's what I saw at DHS in 2020.
2020 brought a challenge greater than anything we could have imagined when the year began, a worldwide pandemic of historic proportions. DHS rose up and together met that challenge head-on with hope and heroism.
This last year will be a year that your children and your grandchildren will study about in the history books. We have lived history this last year. And what you've all done, how you stepped up and how you turned everything around, is something that we need to look back on and remember. I hope you're very proud of what you did at this time in history. There are people that are alive today because of what we did.
And today, I'm pleased to announce that we did receive approval from Medicaid Services in Washington to start these direct care payments for long-term care services. This is extraordinarily good news for those that have been on the front line, that have been putting themselves at risk.
In all, DHS issued millions of dollars to frontline workers at hospitals, nursing homes, and the human development centers. That money was part of federal CARES Act funding to help states deal with the pandemic.
I'm pleased to announce that DHS can now cover the cost of child care for essential workers throughout the state of Arkansas during this pandemic.
DHS also dispersed tens of millions of dollars to make sure essential workers had funding for child care.
All those in favor of the proposal from DHS related to EMS and EMT services.
And to support primary care physicians, hospitals, nursing homes, paramedics, and child care centers. We also looked for federal program flexibilities, like online purchasing and payment for SNAP clients. Pandemic food benefits to help families with extra costs for lunches when schools closed, and supplemental SNAP to help clients make ends meet and afford healthy meals.
Today, the Arkansas Department of Human Services announced additional aid through a COVID-19 Emergency Solutions Grant, and that's $23 million available for Arkansans.
We rolled out grants for rental assistance for folks who are facing eviction, funding for low-income communities and communities of color hard hit by the pandemic, and financial support to offer additional mental health services and supports for veterans and their families across the state.
You know, DCFS is still out there. Other than we may look a little different, we're still operating, sure, and making sure that kids are safe and living the mission.
All the while, our frontline workers at the HDCs, the health center, state hospital, county offices, DCFS, APS, and OLTC surveyors monitoring nursing homes all continue doing what they do best: caring for our clients, keeping them safe, and making sure they have the services they need.
They have a place for us to sleep here at the hospital, so it's really just been kind of working as needed to help out with the patients that are infected.
Early in the pandemic, fulfilling our mission meant being resourceful, as everyone struggled with shortages of PPE and limited information about the new virus.
97.3.
We had to change how we do business virtually overnight just to make sure people were safe, like doing SNAP interviews over the phone, suspending dozens of rules.
Welcome, please step up to the station.
And taking temperatures at the door of our offices.
Do you have any food at home right now?
DABA and DDS even stood up a COVID command center for clients who get services in their home.
Or do you have somebody going grocery shopping for you?
Making 13,000 personal phone calls each week to connect clients to resources and make sure they had everything they needed to remain at home safely. Whether we were ready or not, we zoomed into using technology for meetings and learned to laugh through our struggles.
Hey Nick, we're calling you from the conference room. We thought it might be easier just to connect this way.
From what?
Is this Nick?
No. I think you got the wrong number.
No, sorry.
Okay, thank you.
As we all grew more comfortable with going virtual, technology became an innovative tool for DHS to use to overcome barriers a lack of in-person meetings presented.
Christy, I'm going to put you on the spot a little bit as my co-host.
DCFS launched Zooming for Zero as a way to continue finding safe, stable, forever families for children in foster care waiting to be adopted.
Tonight's ceremony is quite different than in many years, and we are so honored to be able to have the opportunity to thank all of our foster parents.
The division also moved its Foster Parent of the Year banquet exclusively online, with one exception, and even that was shared on Facebook Live.
And then we are going up and surprising our 2020 statewide Foster Parents of the Year in Arkansas. We're so excited. What a fun way to share with these families and celebrate them.
Hi. Congratulations.
Surprise!
DABA also used online meetings and social media to tackle the issue of substance abuse and recovery.
I also go down to intake, so that's me traveling to Alexander, going down to intake and meeting with the youth directly. I couldn't do that anymore because we had to put limits on visitation. And I was like, well, while I'm sitting here, some of my most impactful experiences was hearing somebody else's story. I still want to do that. So I've been going to online recovery meetings.
Welcome everybody to the Recovery Clinic.
There's Recovery Clinic on Facebook. There's AA/NA meetings on Zoom right now. So I was like, why don't I just bring that to our youth? And we have Roger LaFleur over at Dermot.
As DHS shifted its operations online, the pandemic also sped up plans to use technology to increase access to services for clients, like with telemedicine rules in Medicaid.
In the middle of all this, no one wanted to stop the progress we were making.
Divisions also began to streamline processes for providers. DCCECE took its paper-based background check process completely digital. Child maltreatment registry checks for teachers, volunteers, and child care workers also went online.
There were many times I looked at folks here and said, okay, so do we need to slow down on some of the things that we had hoped to get done this year? And every time everyone would say, no, 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 we need to keep going. We've got to keep going. This will be over. And when it is, we're coming out stronger than we went in.
Even as everyone shifted to deal with the complexities of a global health pandemic, DHS staff continued moving forward on key department projects, reaching monumental milestones and making the delivery of services even better.
As we move forward with the Aries pilot, it's a momentous occasion. Thank you all for attending.
DCO launched the department's new integrated eligibility system and a major upgrade to the Access Arkansas online application, with little fanfare after nearly 2 years of planning and development. The system will be the IT backbone for DHS far into the future, and it happened in the midst of multiple other major IT projects the team worked on to keep on track. DIPSQA overcame a tremendous backlog in processing medical needs applications by revising its operations and improving workflow processes. The Division of Youth Services continued its reform efforts, closing another residential facility, transitioning its facility back to a single provider for private management, and transforming its community-based programs.
And this will mean that 700 additional individuals will be evaluated, and they will be provided home and community-based services that will enhance their life to give them the services that they need.
And using funding from our Innovative Pass program, the Division of Developmental Disability Services worked with the governor to announce funding for 700 additional waiver slots for people with developmental disabilities.
And then arms go in with the opening to the back.
At the same time, DDS made important investments in the staff and facilities at the HDCs, boosting all direct care positions to the CNA level and establishing its own on-site training program at each campus.
There we go.
Plus, construction of new buildings on 2 campuses got underway to ensure residents had safe places for recreation and living. DCFS got approval for an array of new prevention services to help strengthen families before children ever need to enter foster care. The Division of Medical Services began its rollout of electronic visit verification to make sure in-home clients are truly getting high-quality supports before providers can bill.
Dashing through the snow on a one-horse open sleigh, o'er the fields we go, laughing all the way.
And since laughter is the best medicine, especially given the strain of the public health emergency, the team still made time for some socially distanced fun. The response of the DHS team in the midst of the most serious public health challenges any of us have faced made a real difference for the communities we serve.
Saw heroism again and again and again when people went the extra mile. to take care of our residents, to take care of our beneficiaries, at times at great personal risk.
2021 will bring its own challenges, but as this past year has taught us, where some may see insurmountable odds, when we at DHS band together to serve those who need us most, we can turn those obstacles into opportunities.
I do hope that this year ends up being a year, first of all, for health. And I really do look forward to us being able to engage again in Blue and You and a lot of the fitness activities that can help us all have better health. There's still always going to be hope, because hope is what we do. Hope is what we bring to people in need in Arkansas, and we help them. Coming out of a pandemic, people will need hope. They will need pathways back. And our services and what we do are going to be incredibly critical to giving Arkansans hope that they can get back to a good future. And it's going to take a little time to heal. All of us, all of you who work here have been under great stress. Our community, our neighbors have all been under stress. Our medical system's been under stress. And a lot of what we do here will be to help with that healing, to help people both with the mental stress, but to also help with the economic stress. So 2021, a year where we hope to celebrate health, a year where we continue to have hope and continue to help create hope, and a year where we help Arkansas heal from this public health emergency that has taken such a toll. Thank you again for all you do, and I'm looking forward to 2021.
Good afternoon to all my friends at DHS, and Happy New Year as you close out one of the toughest years in our history. You have faced challenges we couldn't have imagined a year ago, and you found creative solutions to navigate this worldwide health crisis. As you celebrate your successes over the past year, I would like to add my thanks for keeping Arkansans safe and ensuring they had the services they needed. Let me specifically express my thanks to the long-term care surveyors who helped nursing homes follow infection control practices, to the child welfare, adult protective services, and public guardian workers who went into homes to ensure everyone was safe, to county office staff who met with clients, to child care staff who made sure child care centers were safe and had the supplies they needed, and that essential workers had access to financial assistance, to the finance and procurement teams who processed millions in CARES Act funds and made sure everyone at DHS had clean offices and the personal protective equipment they needed, to the rules team who oversaw dozens of rules suspensions because of the public health emergency, to the IT team for making sure everyone could go remote when they needed to, and to all who worked behind the scenes to keep the essential services up and running. And most of all, to those of you who work in our DHS facilities, the Human Development Centers, the State Hospital, the Health Center, Civilian Student Training Program, who are on the front lines battling this virus. Thank you for your service to Arkansas and your fellow Arkansans.